Does your shoulder hurt reaching overhead, working out, or sleeping? Let's talk how to fix it. In this video, we'll cover a treatment approach that is helpful for most people. Let's cover anatomy first. The shoulder is a ball and socket joint, with the ball being the head of the upper arm bone or humerus, and socket being part of the shoulder blade. The ball is held in socket by a combination of rotator cuff muscles, ligamentous tissue called the labrum, as well as bone. Impairment of any of these can lead to shoulder pain and can happen for many reasons. Most commonly implicated are the rotator cuff muscle and tendons. Many diagnostic labels exist, but we treat nearly all diagnoses pretty similarly. Pain is commonly experienced reaching overhead, especially from 60 to 120 degrees, bringing the arm across the body and reaching behind our back, because these positions increase compression and force on sensitive tissue in the joint. How do we make it better? We have multiple options, including exercise, medication, injection, surgery, and time. Let's talk through exercise first. Exercises are the primary treatment. The others are add-ons or tried when exercise does not work. This first set of exercises is easiest and best for someone with high pain levels. You just increase or decrease band resistance as needed to find an appropriate difficulty level. Second set is harder. You just modify the weight, increasing or decreasing it as necessary to get to the appropriate challenge. This final set is hardest and can be continued for a long period by continually increasing weight. Here are two stretches which often help. Simple explanation why is when the upper back moves better, it allows the shoulder blade and joint to move better as well. If you want more exercises or a structured week-by-week program, then check out my phone app. Here is the set, repetition, and difficulty scheme I would aim for. Pay special attention to pain level. We want to push as hard as we can, keeping pain below 3 to 4 out of 10, both during performance and 24 hours after, because frequently pain is delayed. Pain is how we decide if an exercise is too hard and if it is appropriate to progress to harder ones. Exercises aim to increase the strength of the shoulder, improve how well the joint functions, and increase how much force our shoulder can handle before we experience pain. Goal being, we get to where the force placed on the shoulder in our daily life is less than what we build it up to take, thus allowing us to return to our prior activity with less or no pain. What about medications? Unfortunately, no medication will cure this. The role of medication is to manage symptoms, not treat the underlying issue. Ideally, we don't use any at all. If we do, here are our options. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, etc., or acetaminophen, a fancy name for Tylenol, or a combination of both. Opioids are typically not used. We prefer NSAIDs when possible, but not everyone can take them. People with kidney, heart, blood pressure, or stomach bleed issues are recommended not to. In those cases, there are topical lotion-like formulations that can be used, but you have to speak to your physician. If we take medication, recommendation is use the lowest dose for the shortest possible time. Limit it to when symptoms are unusually bad or you have a special event. If you're going on vacation or have some house projects, maybe we take ibuprofen. But we don't take it for weeks when just sitting in the chair with tolerable symptoms. What about injections? We have a few options. Steroids are most common, and research shows they are effective, but only short term. It is not expected to fix or cure anything, and for best results should be paired with exercise, i.e. physical therapy. Research generally shows those who get the injection improve faster, meaning have less pain than those who don't at month 2 or 3. However, at 1 year, those who get the injection are doing the same as those who do not get it, meaning both have the same pain and function. Downside is steroid injections have risk. They weaken connective tissue like rotator cuff tendons and can weaken cartilage like the labrum, especially with repeated injections. So long term, it may worsen the problem, though that's unlikely if you only get one. There are other injections, primarily regenerative medicine, PRP, prolotherapy, etc. These do not have the tendon weakening risk, but are newer and have less evidence evidence of effectiveness and are quite expensive. So you can get them with less worry, but there's no guarantee that they work. It's a bit of a gamble. What about surgery? It can be an option, but specifics vary heavily by your diagnosis, severity, and individual anatomy. Typically, surgery will only be considered in someone with significant symptoms who has tried PT 6 months to 1 year without success. At that point, it's a last resort. Hopefully it helps, but again, no guarantee. Many things can be done, including rotator cuff repairs, where the muscles are essentially reinforced with anchors, and decompression surgery, where bony protrusions may be shaved off to reduce compression of sensitive tissue. You have to see a surgeon to figure out your options though. Overall, effectiveness of rotator cuff repairs is decent when appropriately selected, while other surgeries like decompression don't appear effective in the literature. Finally, how long should you expect recovery to take? Overall, you should expect recovery to take longer than you think. You will likely not be better by 3 weeks. Instead, anticipate a minimum of several months and possibly around 1 year. That is not to say your symptoms will be severe the entire time though. Typically, most recovery happens the first 3 to 4 months. That final 10 to 20% of recovery may be spread over the following 8 months, meaning it occurs so slowly that you can barely tell you are improving. Just know you likely are, it's just really slow and hard to tell. That is what is going on and how we can generally approach shoulder pain. I hope that answered your questions and good luck with your recovery.